Okay.
So actually, Mr. Dwarki was diagnosed with left ear medius disease, and he underwent vertigo therapy sessions. We just briefly ask him about how his condition is. So can you briefly explain about your vertigo problem that you underwent? Vertigo problem.
8th of November I was coming in a scooter. Very slowly I was fell down. So I had some problem. Then I went to the cardiologist and as well as diabetes. They examined everything. They suggested for dog for test. 2D echo. Then also brain MRI scan, everything. Everything was okay. Then finally they said it contact ENT surgeon.
Okay.
I came over here, I met Dr. Pradeep Kumar, ENT surgeon. He said a vertigo problem like that.
Okay.
Then he started giving the medicine and those things. Again, it has happened on 2nd of December on the morning. When I came after preaching my morning work, and when I just entered my house, I started severe giddiness, unbearable, uncontrollable. Finally, I was admitted one day here.
Okay.
That is the 2nd of December.
Okay.
Then doctors gave me some medicines, and also he suggested for vertigos rehabilitation center. And timely helped by Mr. Bhatri Nath. He has given me excellent support and guidance for 15 days. So, lot of questions arises during the course of vertigos session, and he has clarified all the information, and as well as good. And thanks to Dr. Pradeep Kumar and staff members.
So, what do you think? How useful was the vertigo chair?
This is one of the added advantage of sort of this one. Strength has given. I got some confidence. Now I can able to walk 1 hour daily, and also I'm traveling. I'm discontinuing going in 2 wheelers. I am always moving public transport as well as auto. I'm quite confident of going to various places.
And Mr. Dwarki had DHI completed, and his pre-therapy score was 46, which was falling in the category of moderate handicap. And after the therapy sessions, and I did complete DHI questionnaire, which showed 0, which means within the normal limits. And the foam cushion test, initially with eyes closed, he was able to stand only for 7 seconds. And after the therapy or after treatment, he's easily able to stand more than a minute with eyes closed. Okay, thank you, Mr. Dwarki.
Thank you, sir.
So we've got Padmavati here today, and she is 65 years old, and she's been suffering from bilateral PPP condition. Okay, so she's been undertaking vertigo chair therapy sessions. So we will briefly go through her vertigo problem. So how are you today? Can you please describe your vertigo problem before the therapy?
Vertigo therapy ಅಂದ್ರೆ ಅದೇ ಕಂಟೆಸ್ಟ್ ಗೆ ಹೋಗಿದ್ವಿ ಒಂದಿನ. ಹೋದ್ರೆ ಅದು ಡ್ರಾಪ್ಸ್ ಅವೆಲ್ಲ ಹಾಕಿದ್ರೆ ಕಣ್ಣಲ್ಲಿ ಪ್ರಾಬ್ಲಮ್ ಇಲ್ಲ ಅಂದ್ರು. ನೆಕ್ಸ್ಟ್ ಡೇ ತುಂಬಾ ಬ್ಯಾಲೆನ್ಸಿಂಗ್ ಪ್ರಾಬ್ಲಮ್ ಆಗುತ್ತೆ. ಸೊ ನಾವು ಜನರಲ್ ಫಿಸಿಷಿಯನ್ ಕನ್ಸಲ್ಟ್ ಮಾಡಿದ್ರೆ ಅವರು ಇಲ್ಲಿ ಹೇಳಿದ್ರು ನಮಗೆ ವರ್ಟಿಗೋ ಇದೆಯಾ ಟೆಸ್ಟ್ ಮಾಡಿಸಿ ಅಂತ. ಇಲ್ಲಿ ಬಂದು ಮಾಡಿಸಿದ ಮೇಲೆ ವರ್ಟಿಗೋ ಇದೆ ಅಂತ. ಸೊ ಇದರಿಂದ 15 days ಥೆರಪಿ ತಗೋತಾರೆ.
Have you taken any medication during therapy? Okay. So roughly you had about 15 sessions.
Yeah.
So how do you feel? How much improvement have you noticed?
Better, 95.5.
So you feel like okay. And then okay. So the patient had the pre-therapy questionnaire filled, which is DHI questionnaire. The score was 32, and after the therapy, we did try complete the questionnaire, which was showing 4. So initially she had moderate handicap, and the post-therapy score was 4, so which is within normal limits. She had a foam cushion test, initially with the eyes closed, and she was able to stand only for 9 seconds. And after therapy, her balance function has improved a lot. And the foam cushion test showed with eyes closed, she's able to stand for more than 1 minute. Okay, thank you. Hi, so we have patient Shanta here today, and the clinical diagnosis was bilateral BPTV. Okay, she had underwent vertigo chair therapy. I'll just ask her a few questions about the vertigo problem. So ನೀವು ಸ್ವಲ್ಪ ಡಿಸ್ಕ್ರೈಬ್ ಮಾಡ್ತೀರಾ ಪ್ರಾಬ್ಲಮ್ ಯಾವ ಥರ ಇತ್ತು ನಿಮಗೆ?
2013 ತಲೆ ಸುತ್ತು ತುಂಬ ಜಾಸ್ತಿ ಆಗ್ತಿತ್ತು. ಯಾತಕ್ಕೋಸ್ಕರ ಬರ್ತಿದೆ ಅಂತ ಗೊತ್ತಲ್ಲ. 2-3 ಡಾಕ್ಟರನ್ನ ಕಾಂಟ್ಯಾಕ್ಟ್ ಮಾಡಿದೆ. ಅವರು ಥರ ಏನೂ ಹೇಳಲಿಲ್ಲ. ಆಮೇಲೆ ಇನ್ನೊಬ್ಬರು ಇವರು ಪ್ರದೀಪ್ ಕುಮಾರ್ ಒಳಗಡೆ ಎಲ್ಲ ಟೆಸ್ಟ್ ಮಾಡಿಬಿಟ್ಟು ಈಗ ಸಡನ್ನಾಗಿ 15 ಡೇಸಿಂದ ಮತ್ತರಿಗ ಸ್ಟಾರ್ಟ್ ಆಯಿತು. ಅದೆಲ್ಲ ಮತ್ತರಿಗೆಲ್ಲ ಟೆಸ್ಟ್ ಎಲ್ಲ ಮಾಡಿದ್ರು. ಮತ್ತು ಫಿಸಿಯೋಥೆರಪಿ ಮಾಡಿಸಿ ಅಂತಂದ್ರು. ಇದು ಮಾಡಿಸಿದ್ಮೇಲೆ ಬೆಟರ್ ಕ್ಯೂರ್ ಆಯ್ತು.
ಸೊ ಈ ವರ್ಟಿಗೋ ಥೆರಪಿಯಿಂದ
ಫಿಸಿಯೋಥೆರಪಿಯಿಂದ ಸ್ವಲ್ಪ ಕ್ಯೂರ್ ಆಯ್ತು. ಇವಾಗ ತಲೆ ಸುತ್ತ ಬರ್ತಾ ಇದೆ.
ಸೊ ಇದು ಈ ಥೆರಪಿ ಜೊತೆ ಬೇರೆ ಮೆಡಿಸಿನ್ಸ್ ತಗೊಂತಾ ಇದ್ದೀರಾ?
ಮೆಡಿಸಿನ್ ಕೊಟ್ಟಿದ್ರು ಸ್ಟಾಪ್ ಮಾಡ್ತೀವಿ. ತಗೊತಾ ಇಲ್ಲ, ಇದರಿಂದಲೇ ಕ್ಯೂರ್ ಆಗಿದೆ.
ಓಕೆ ಓಕೆ. ಸೊ her DHI, Dizziness Handicap Inventory Questionnaire, the scoring was 50 initially before the start of vertigo chair therapy, and after therapy she roughly had about 15 sessions, and the post-therapy score was 2, so which is within normal limits. And she had a foam cushion test where with the eyes closed she was able to stand only for 2 seconds, and now after the therapy she can stand more than 1 minute with eyes closed. Okay, thank you. Okay, Surindam ಅವರೇ ಹೇಗಿದ್ದೀರಾ ಇವತ್ತು? ಹೇಗಿದ್ದೀರಾ? ಸೊ ತಲೆ ಸುತ್ತೋದ ಬಗ್ಗೆ ನಿಮಗೆ ಎಷ್ಟು ಪ್ರಾಬ್ಲಮ್ ಇತ್ತು ಮೊದಲು?
ಮೊದಲಂದ್ರೆ ಡೈಲಿ ಇರ್ತಾ ಇರಲಿಲ್ಲ. ಯಾವಾಗಲೂ 15 ದಿನಕ್ಕೆ 1 ತಿಂಗಳಿಗೆ ಒಂದ್ಸಲಿ ಸ್ವಲ್ಪ ಲೈಟಾಗಿ ಇದ್ರೆ ಕೂತ್ಕೊಂಡ್ರೆ ನಾನು ಓದ್ತಾ ಇದ್ರೆ ಸ್ವಲ್ಪ ಲೈಟಾಗಿ ಸುತ್ತೋದ ಮತ್ತೆ ಇರ್ತಾ ಇರಲಿಲ್ಲ. ಅಂದ್ರೆ ಸೈಡ್ ಆದ್ರೆ ಬರೋದು. ಈಗ ನನಗೆ ಒಂದು 1 ಮಂತಿಂದ ನನಗೆ ಸೈಡ್ ಆಗಿ ಏನಾಗಲಿ ತಲೆ ಸುತ್ತ ಏನು ಬಂದಿಲ್ಲ.
ಓಕೆ. ಸೊ ಇದು ಈ ವರ್ಟಿಗೋ ಚೇರ್ ಥೆರಪಿಗೆ ಸೊ ರಫ್ಲಿ ಎಷ್ಟು ಸೆಷನ್ಸ್ ಕಂಪ್ಲೀಟ್ ಆಯಿತು ನಿಮ್ಮದು?
ನಮ್ದು ಅದೇ ನೀವು ಹೇಳಿದ್ರಲ್ಲ ಒಂದು ದಿನ ಅದೇ.
ಓಕೆ. ಸೊ ಆಲ್ಮೋಸ್ಟ್ 14 ಸೆಷನ್ ಆಗಿದೆ ನಿಮಗೆ.
14.
ಓಕೆ. ಸೊ ಈ ಥೆರಪಿ ಜೊತೆ ನೀವೇನಾದರೂ ಬೇರೆ ಮಾತ್ರೆ ಆ ಥರ ತಗೊಳ್ತಾ ಇದ್ದೀರಾ?
ಈ ತಗೋತಾ ಇಲ್ಲ. ವರ್ಟಿನ್ ಒಂದು, ಆಮೇಲೆ ಇನ್ಯಾವುದೋ ಇನ್ನೊಂದು ಕೊಟ್ಟಿದ್ರು.
ಸೊ ಎಷ್ಟು ವಾರ?
15 ಡೇಸ್ ತಗೊಂಡೆ.
15 ಡೇಸ್ ಮೊದಲು ತಗೊಂಡಿದ್ದೀರಾ? ಓಕೆ. ಸೊ ಈ ಥೆರಪಿಯಿಂದ
20 ಡೇಸ್ ತಗೊಂಡಿದ್ದೀನಿ. ಫಸ್ಟ್ 5 ಡೇಸ್, ಆಮೇಲೆ 15 ಡೇಸ್.
ಓಕೆ ಓಕೆ. ಸೊ ಬಟ್ ಈ ತಲೆ ಸುತ್ತು ಪ್ರಾಬ್ಲಮ್ అంటే ಒಂದು 1 ಇಯರ್ ಇಂದ ಆಯ್ತಾ? ಯಾವಾಗ?
ಅಯ್ಯೋ ಸುಮಾರು ನನಗೆ 30 ಇಯರ್ಸ್ ಇಂದ ಇತ್ತು.
ಮೊದಲಿಂದ ಇತ್ತು. ಓಕೆ ಓಕೆ.
ಅದು ಬಿತ್ತು, ಅದು ಶುರುವಾಗ್ಬಿಟ್ಟು.
ಓಕೆ ಓಕೆ. ಸೊ ಈ ಟ್ರೀಟ್ಮೆಂಟ್
ಏನೋ ಅದೇ ಫ್ಲಾಟ್ ಆಗದೆ ಎಂದಿದ್ರು ಅಷ್ಟೇ.
ಸೊ ಈ ವರ್ಟಿಗೋ ಚೇರ್ ಥೆರಪಿಯಿಂದ ನಿಮ್ಗೆ ಎಷ್ಟು ಇಂಪ್ರೂವ್ಮೆಂಟ್ ಆಗಿದೆ? ಎಷ್ಟು ಪರ್ಸೆಂಟ್ ಇಂಪ್ರೂವ್ ಆಗಿದೆ ಅಂತ ಅನ್ಸುತ್ತೆ?
80% ಈಗ ಕಾಣ್ತಿಲ್ಲ. ಮುಂದೆ ನೋಡ್ಬೇಕಾದ್ರೆ.
ಓಕೆ. Sunandama, she had we completed DHI questionnaire. So her pre-therapy was the score was 42, and the scoring post-therapy, like after roughly about 14 to 15 sessions, her score was 8. So initially she had a moderate handicap, and then now the score after the therapy it's about 8, so which is within normal limits. Okay, thank you, Sunil. Hello folks, we have Nasima here, and she's a known case of right side BPPV, and she's 46 years old, and she has no associated health conditions like blood pressure problems and diabetes. Okay, so hi Nasima, how are you today?
Fine.
Okay, I'm just going to ask you a few questions. Yeah? So can you briefly explain your vertigo problem before the start of the vertigo chair therapy?
वर्टिगो शुरू करने से पहले मुझे सोने के जब भी ऐसा चक्कर आने लगा, फिर वहाँ से उठी तो चक्कर, और ऐसा फिर राइट लेफ्ट ऐसा करी चक्कर, ऊपर से देखी चक्कर, एक रहम से डिप्रेशन के जैसा रहना, टेंशन रहना माइंड, ऐसा सब बहुत कुछ प्रॉब्लम था.
Okay. So have you been to any other doctors before and have taken any other medications?
डॉक्टर के पास आग दिखाई, उन्होंने आपको वर्टिगो चेयर का टेस्ट कर लेके आओ करके बोले. उसके बाद आपको चक्कर के लिए स्टेमेटल MD लिखे दिया, लेकिन मैं नहीं ली, टैबलेट्स नहीं खाई.
Okay.
ये बाद में थेरेपी का यूज करें, 15 सेशन यूज करते हूँ.
Okay.
99%.
So before you came here to the ENT doctor, have you seen any other specialist? like a
नहीं
neurologist?
नहीं, ये फर्स्ट डॉक्टर न्यूरो सर्जन के पास गई, वो न्यूरो सर्जन के हिसाब से एक्सरसाइज और नेक्स्ट फोर्थ करके टैबलेट्स देखे, 10 मंथ्स वो खा के देखी।
Okay.
लेकिन मुझे कान का दर्द नहीं कम हुआ, फिर ये प्रदीप कुमार डॉक्टर के पास गई।
So roughly how many sessions have you undergone?
15.
And during the therapy session, where you undertake, have you been taking any other medications to reduce your vertigo problem?
नहीं, कुछ भी नहीं दी, ये थेरेपी का ही यूज करते हैं।
And what is your opinion about the vertigo chair therapy sessions and how beneficial is it for you?
मेरे तरफ से परवाह नहीं, अच्छा है ये ट्रीटमेंट। अगर कोई भी किसी को भी मेरे जैसा ऐसा प्रॉब्लम है तो ये कर सकते हैं, नॉर्मल हो सकता है।
How much is reduced? Like,
रेड्यूस होता है,
how much percentage?
वो है 99% कम है।
Okay. Thank you. And we did a DHI inventory questionnaire, like it's called a dizziness handicap inventory. So before the start of therapy, her score was 38. So that indicates moderate handicap. And after the vertigo chair therapy, and her score was 2, so which is within normal limits. Okay, thank you. I will briefly go through the vertigo chair therapy sessions that Nasima underwent. Okay. So initially we started at the level of 3 speed, that is RPM, rotations per minute, and then eventually after a few sessions we increased it to 8 to 9, and then further up to 14. So now the chair is rotating clockwise. Okay, so now I'm going to do that way. So this is anti-clockwise. So the head positions varies at clockwise and anti-clockwise. Can you put the head down? Okay, that one head position. And after a few rotations, with the head positions down, and then the patient has to put the head backwards. And we can change the head position to the back side. Okay. And we do it a few rotations. And then can you put your head at a particular angle? And to the left side. Now go to swing the chair. So it's at a 180-degree angle. So at this angle, I ask the patient to slowly move the head from left to right. Very slowly. Okay. Thank you. Come.